Okay, we will see the blood supply of kidney or the blood circulation. We will see everything about this. Kidney, as you know, kidney continuously cleans the blood and adjusts its composition. So kidney possess an extensive blood supply. Under normal resting condition, the renal arteries deliver approximately 1/4 of the total systemic cardiac output to the kidney each minute. That means about 1200 ml. So this is the blood circulation of kidney or arterial blood supply of kidneys. So renal artery arises from right angle from the abdominal aorta, and each renal artery divided into segmental arteries in each ileus. So we will start from the heart. There is a heart here. For instance, heart is here. In heart there is 4 chambers. This is right atrium. This is right ventricle. This is left atrium, left ventricle. So in the left ventricle, aorta will emerge it, and there is ascending aorta and aortic arch, and there is also descending aorta. Descending aorta will divide into this is thoracic aorta and this is abdominal aorta. From below the diaphragm there is abdominal aorta. In abdominal aorta, 2 arteries emerge from abdominal aorta at right angle. This is renal arteries. This is renal arteries. This is right renal artery. This is left renal artery. So this, by the way, this abdominal aorta is found on the left side of the midline, so that right renal artery is longer than left renal artery. So this renal artery will go into the kidney, and around the hilum of the kidney will divide into 2 branches, anterior branch and posterior branch, then will give into segmental arteries. So here is the renal artery. Then renal artery will divide into segmental artery. Segmental artery, by the way, there are 5 segments of the kidney. This is superior segment and anterior superior segment, anterior inferior segment, and posterior segment. All 4 segments are found from anterior branch of renal artery, and the posterior segment comes from the posterior branch of renal artery. So superior segment or apical segment is supplied by superior segmental artery, and anterior superior segment is supplied by anterior superior segmental artery. Anterior inferior segment is supplied by anterior inferior segmental artery, and inferior segment is supplied by inferior segmental artery, and posterior segment is supplied by posterior segmental artery. So we have 5 segmental artery. That means superior segmental artery, inferior segmental artery, anterior superior segmental artery, anterior inferior segmental artery, and posterior segmental artery. There are 5 segmental artery. This segmental artery will divide into in biologically there is lobar artery, but in this case segmental artery will divide into interlobar artery. Interlobar artery will go into the renal columns between the renal pyramids. This interlobar artery, I will show you in picture later. This interlobar artery will divide into arcuate artery. Arcuate artery will just branch arches at the corticomedullary branch. Arcuate artery will emerge. So arcuate artery will divide into interlobular artery. interlobular artery supplies the cortex of the kidney. This interlobular artery finally will divide into afferent arterioles. Afferent arteriole is supplies the nephron. Afferent arteriole then will just supply blood into the glomerulus. This glomerulus is a kidney capillary. It's a fenestrated capillary. This glomerulus is important for blood filtration. So this is important for filtration. So in the glomerulus there is, for instance, if it is this glomerulus, there is afferent arteriole here and efferent arteriole here. This means in the glomerulus there is exchange on the filtration, not exchange but it's filtration. In the glomerulus there is also efferent arteriole. So efferent arteriole in the glomerulus, after the glomerulus there is efferent arteriole. By the way, glomerulus is the only capillary that is found between afferent arteriole and efferent arteriole. That means that is found between two arterioles. As you know, all capillary in the body is found between venule and arterioles. There is venule here. For instance, there is large artery, there is medium artery, and there is small artery, then arteriole, then capillary, then venule, then small vein, medium vein, large vein. So that there is between venule and arteriole there is capillary, but in this case there is two capillary here. There is two arteriole. Glomerular capillaries found between two arterioles. That means afferent and efferent arteriole. But whereas other systemic capillaries are found between venule and arteriole. So efferent arteriole will give into two capillaries. One is peritubular capillaries and vasa recta capillary. So in the kidney there is also another capillary, so vasa recta capillary, peritubular capillary. These capillaries is not important for filtration but important for exchange, actual exchange. So like other capillaries are important for exchange of nutrients, foods and other materials. So like that, peritubular capillary and vasa recta works the actual exchange of nutrients, gases and the like. So peritubular capillary and vasa recta is another capillary. So after peritubular capillary and vasa recta, these capillaries, by the way, peritubular capillary supplies like proximal connector tubule and distal connector tubule of the nephron. Vasa recta supplies loop of Renal like descending limb and ascending limb. That means peritubular capillary found on the cortical region, vasa recta found on the medullary region. After this, after peritubular capillary and vasa recta, it will be changed into interlobular vein. Interlobular vein. Then interlobular vein will change into arcuate vein. Arcuate vein will be changed into interlobar vein. Interlobar vein will change it into renal vein. So renal vein emerges at the hilum of the kidney. So by the way, as the hilum of the kidney, three structures can be arranged from anterior to posterior. So anterior to posterior, as the hilum of the kidney, first we will get renal vein anteriorly. Then in the middle we will get renal artery. Then at the back we will get renal pelvis or ureter. We will get this. So this is the posterior. Renal pelvis is found on the posterior, renal vein is found anterior, renal artery is in between. But sometimes if there is third renal artery found behind the renal pelvis, so other like lymphatic vessels and sympathetic nerves also pass in this renal hilus. So renal vein also will go into will drain or tribute into inferior vena cava. Inferior vena cava. By the way, inferior vena cava is found on the right of vertebral column. So left renal vein is almost 2 times longer than right renal vein. So the artery, right renal artery is longer than left renal artery, but in the vein, left renal vein is longer than right renal vein. So these 2 left and right renal vein also, left renal vein is from the left kidney, right renal vein is from right kidney, will drain into inferior vena cava. Inferior vena cava will go into will drain into right atrium. So this is the blood circulation of the kidney. So kidney, as you know, we are arising from the left ventricle and goes this and will pass this way, and also finally will join into the right atrium. So that this is known as blood circulation of the kidney. So seems like this blood circulation. For instance, if this is the kidney, this is a slight part of the if it is a slight part of the kidney, this is the cortex. This is the cortex. This is the renal medulla. This region is medulla. This one is renal pyramids. So if it is renal pyramids, this is also renal major, minor calyx and major calyxes. So that renal artery comes in this way and will divide into 2 branches, anterior posterior. Anterior part will give 4 segmental arteries. The posterior part will give 1 segmental artery. This segmental artery will gives us interlobar artery. Interlobar artery passes through the renal columns or between 2 pyramids. So interlobar artery will give us arcuate artery. Arcuate artery found in this way, between the junction between the corticomedullary junction. So this arcuate artery will give us interlobular artery. Interlobular artery supplies the cortex, then will change it into efferent arteriole. After this, here is the glomerulus. This is the glomerulus is the tuft of capillary. So afferent arteriole will give us in the glomerulus as this area. Just filtration. This is a fenestrated capillary, so that within high pressure, like waste materials and some minerals, and pass through the this renal capsular space and will go into proximal constitutive. But the blood, the filtrated blood will back into and go into the efferent arteriole. This is afferent arteriole. This is efferent arteriole. This efferent arteriole will divide into peritubular capillary and vasa recta. This peritubular capillary and vasa recta separates the proximal constitutive, distal constitutive, collecting duct, and the loop of Renal, so that the urine will go into the filtration, reabsorption, secretion, and ultimately, finally, it will change it into urine, and the blood also processed and will back into the body. So in general, this is all about the blood circulation of the kidney. This is all about the blood circulation of the kidney. We will come back again in another section. Thank you for your attention.